The ability to grow and sustain cancer means now we can start doing real science on human tissues, and we can never do this before. What investigators are excited about is mass screening of either many drugs to one tumor, or one drug to many tumors. These organoids can be grown, they can be banked, you can build up large libraries of them, and it's opening a whole new world of high throughput science for human biology, which we never had before. In addition, it's possible for clinicians to grow these organoids and run, if you will, clinical trials in a dish. You can, while in real time, while caring for a patient with, let's say, metastatic disease, and you're trying the first-line chemotherapy, you can grow these tumors in the lab, you can try all the available existing approved agents, and you can try other cancer drugs, and you can try other drugs that aren't known to be cancer drugs in screening tests. So the expense and time for which you can expand these things and test them has been shrunk. The idea of using the organoid system as a platform by which to do chemotherapy screening of a tumor has been adopted by clinical investigators. It's not routine clinical practice, but there are a number of investigators around the world who are doing exactly that. It's primarily in colon cancer restricted to patients who have more refractory tumors. This technology is developed for gastrointestinal cancers, but it can be used for solid organs such as the pancreas and the liver as well.
Okay, but those organs don't have crypts.
No, they don't, but they also have stem cells that grow in a niche in a similar fashion, and many of the growth factors overlap with those of the intestinal stem cells. I'm hoping in my own field this is going to give us a new means, a dynamic test by which we can see a patient, biopsy the tumor, grow it, test it to radiation, and know, maybe not exactly, but have a pretty strong confidence that these certain tumors are going to respond very well to radiation, others might respond equally well to chemotherapy. So you could see how tailored and what we call precision medicine, matching the patient and the tumor to the right treatment, could very much be enhanced by this organoid technology. The organoids have their limitations. They have sampling biases. They don't biopsy the entire tumor. We know tumors can be genetically heterogeneous. And if you take 4 random biopsies from a large tumor, you're probably going to get 4 slightly different organoid cultures. And within that culture, there's a genetic heterogeneity within them. But again, we can study that heterogeneity. You can see how resistant clones emerge. You can determine were they pre-existing, did they evolve? So there's almost limitless applications of organoids because there's almost limitless questions about tumors.